Okay, so now moving on to our next eye defect, we have photophobia. So, photophobia is also known as light sensitivity, and it's basically a condition where bright light causes discomfort or pain in the eyes. Now, it can result from migraines, eye strain, or underlying conditions like dry eye or infections. So, excessive screen use and unprotected exposure to harsh light are common triggers, and the consequences of these are severe. Now, they can include difficulty functioning in brightly lit environments, they can lead to headaches, and also excessive tearing, which also impacts the daily activities and quality of life. So, a practical solution is to wear polarized sunglasses or transition lenses to reduce glare and also manage light exposure. So you should also adjust indoor lighting with dimmers or softer indirect light sources. And if screens are a trigger, you should try use anti-glare filters or enable dark mode. So dark mode or night mode is a feature that is available in some laptops, so you should try that. And you should regularly consult an eye specialist in order to address any underlying causes. So yeah, as you can see in the screen, it's one of the major causes of photophobia is the overexposure to bright screens, especially in dim environments. So at night, in the dark, when you're just using your phones and it's on maximum brightness, this can be really harmful because it can lead to conditions like photophobia. Okay, so now we're moving on to our next defect, which is retinal damage from blue light exposure. Okay, so you see a diagram over here. So now we're going to explain this diagram in relation to the retinal damage due to blue light. So the diagram basically shows how different wavelengths of light interact with the eye's structures, and it focuses on blue light's absorption and transmission. So in the visual light spectrum, you can see that visible light spans from approximately 300 nanometers, so that's violet, to 750 nanometers, so that's red. Remember the visible light spectrum comprises of all the rainbow colors, so red, orange, yellow, green, blue, indigo, and violet. Okay, so blue light in this spectrum lies in the range of 400 to 500 nanometers. So this has higher energy compared to other visible light. And UV light, so ultraviolet light is less than 400 nanometers, and it's mostly absorbed by the cornea and the lens. So it offers some natural protection for the retina. So, looking at the different light absorption percentages, so the cornea and the lens absorb a significant portion of UV light with very little reaching the retina. However, blue light is poorly absorbed by these outer layers and it penetrates deeper into the eye. So, looking at the retinal transmission, a large portion of blue light, so around approximately 65 to 70% reaches the retina. And the macular pigment in the retina, so remember we looked at all these, the macula, the fovea, and all these structures in our very first video on the eye anatomy. So make sure you watch that. Now, the macular pigment in the retina, so particularly concentrated in the central macula, it absorbs the blue light in the range of 459 to 480 nanometers. Now, this helps protect photoreceptor cells, but is not completely effective, which leaves the retina vulnerable to oxidative stress. So, looking at the implications of blue light on retinal damage. So, high energy blue light can induce oxidative stress in retinal cells, and this can lead to photochemical damage. And chronic exposure may contribute to conditions like age related macular degeneration, which we looked at in our we looked at how, age and genetics affects the eye and it can lead to some of these eye problems and is a major um, it plays a major role in the factors affecting vision. So, looking at this diagram over here, So this is the retinal anatomy and cellular rays. So it provides a detailed view of the retina's microanatomy, and it emphasizes the layers and cells involved in visual processing as well as their susceptibility to blue light damage. So in A, so where you can see part A over there, so it's basically the retina overview, okay? So the retina is the innermost layer of the eye, and it's responsible for converting light into neural signals. And blue light, because of its high energy, can penetrate deeply into retina, causing stress on multiple layers. So the in part B, you can see the photoreceptor cells. So the photoreceptor layer, sorry. So the cones, which are responsible for color vision, and the rods, which are responsible for low light vision, are directly affected by the blue light. So we looked at cones and rods in our first video on eye anatomy. So excessive blue light can damage the outer segments of photoreceptors and lead to reduced function or cell death. And then for the pigment epithelium, so this layer basically supports photoreceptors by recycling visual segments and pigments and managing oxidative stress. So blue light induced damage increases oxidative stress here, and it potentially overwhelms the protective mechanisms. And then the outer and inner nuclear layers. So these layers house the nuclei of the photoreceptor and the bipolar cell. So we looked at bipolar cells as well in our video on eye anatomy and structure. So damage here disrupts signal transmission from the photoreceptors to the brain for interpretation. And then the ganglion cell layer. So the ganglion cells transmit signals to the optic nerve. So blue light exposure may contribute to apoptosis. Okay, so apoptosis is basically a scientific term you use for cell death. So remember, apoptosis is cell death, so you can use this interchangeably. And this is implicated in conditions like glaucoma. So looking at the supporting structures, we have the Muller cells. Now, these glial cells maintain retinal structure and help manage oxidative stress, and prolonged blue light exposure can impair their protective role. And then the microglia and the astrocytes. So these cells support neuronal health and also mediate inflammation. And overexposure to blue light may trigger an inflammatory response and contribute to retinal damage. So the key takeaways I want you to just note from this diagram is that high energy blue light penetrates deep into the retina, and it poses a significant risk of oxidative stress and photochemical damage. And retinal structures like photoreceptors, pigment epithelium, as well as supporting glial cells are particularly vulnerable. And chronic blue light exposure can lead to long-term damage, including conditions like age-related macular degeneration as well as retinal inflammation. So, as we conclude on this topic of eye defects and how they're caused, I want to quickly talk about. Okay, so we've looked at the digital eye strain. We have looked at myopia. We've looked at CVS or computer vision syndrome and blue light exposure. So, just some prevention tips in general. Of course, we will be looking at this in our slides that are still coming. So, I want to talk about 5 main prevention tips. So the first one is to follow the 2020 rule. This is a must, and I know you have heard this from your opticians. So remember, every 20 minutes you look at something 20 feet away for at least 20 seconds. Second, I need you to adjust your screen brightness and also use anti-glare screens, sorry. Then you need to maintain proper lighting to reduce screen glare. Then fourth, I want you to blink frequently to keep your eyes moist. And lastly, you should use blue light blocking glasses if needed. So whenever you go make your glasses, make sure they're blue light blocking. Okay.